I'm Dr. Melanie with Venture Chiropractic, and today we're going to be talking about chiropractic care and tummy issues that infants and children may be experiencing. It is a common complaint that I have parents and caregivers bringing their children into me to check over and see if there's anything that chiropractic care can do to help for colic, reflux, increased gas, difficulties feeding. And though indirectly can be affected, there are many tools and tips that we also provide that can help them and the individuals caring for this child to feel better and receive some improvement. Chiropractic care can help release tension, improve range of motion, check tissues around the mouth, neck, and back to make sure that they are moving as well as they can and are not triggering some of these issues that do lead to reflux, feeding challenges, and constipation. Colic too, you have a baby that's crying, not sleeping well, can really interfere with the day-to-day of not only that child, but everyone involved with the care of that child. So in addition to helping with gentle adjustments and doing some stretches and exercises, all of these are of course modified to the age of the child and what is going on. It is my goal to help restore proper movement, have good alignment, and to remove any interference that could be putting pressure on the muscles and the nerves that are causing some of these issues. The mouth is the window to what's happening in the tummy. So one of the places that I always spend some time is looking at oral function, how baby is feeding, whether it's bottle, breast, or even table food, and getting them to the right individual that can do a deeper comprehensive evaluation if necessary. When we are not latching well, again, it can be bottle or breast, so we're talking about more of an infant, that opens up a window where gas can enter into the mouth. As they swallow, maybe they're not good at burping, they can't move that air back out, it gets stalled in the belly. And as that gas is stalled and sits there, it is like a tube of toothpaste, you're just squeezing it back and forth, and it can cause a lot of irritability, upset, crying, lack of pooping, for example, increased gas when this occurs. So what we want to do is check through the neck, make sure it's moving properly, they have good range of motion, what those joints are doing, how well those are moving, and then also the tissues in the mouth, as I mentioned. One thing, as baby latches, that tongue should be able to lift all the way up to the palate or the hard part of the mouth and make a good seal. If that seal is not happening, you may hear a noise that sounds like this, and they are losing that seal. As that tongue moves, that is pushing gas down into their tummy. There's a lot of components involved when you're looking at the feeding function, the suck swallow reflex that needs to happen in a coordinated way that we may have to do a deeper dive, as I mentioned before. Resting and digesting happens together. So if babies are not digesting their food, taking food in properly and moving it through their body in and out in an effective, time-efficient manner, they are going to have some aches, pains, things that are irritating them, that are causing them not to sleep well and maybe not be as relaxed and playful. In terms of nutrition, this is another area that I dive into. We may need to navigate for a little bit more the older child, what types of food they're eating. I always encourage parents, eat the rainbow, eat the perimeter of the store, try to minimize the amount of food that you're giving your child going into the center of the grocery store, because again, you're leaving the nutritional benefit behind when you start eating more of your food in a box or a bag, for example. As you're eating the rainbow, you get more minerals, vitamins, less need for supplements and assistance when you eat a good, healthy, well-balanced meal first, and then we supplement with vitamins second. When we're looking at tummy issues, probiotics, fish oils, magnesium are a couple of things that I may recommend, and then I can help with dosing and such, and when to introduce those items into the child's diet that can help them decrease some of the difficulty that they may be experiencing with the tummy. Make sure your child is also properly hydrated and reduce sugar as much as possible, which is always difficult because sugar is everywhere. A nice stretch that I wanted to show. So this is utilized with an infant when you can hold them. So we take the child and we hold them left side down. The tummy is on the left side. In your arms in this football hold position, my arm will go in between their legs and hold the downside hand and arm. As they're here, my hands are creating a little bit of a downward gentle pressure on their belly and holding that pressure on their tummy. In this position, you can rock, you can move around Exercise balls work great for the caregivers to keep you in a smooth rhythmic motion, but that resistance over the belly and that slight downward stretch on the diaphragm, their major breathing muscle, can help move gas through the body a little more effectively. So that is one really great stretch, the diaphragmatic stretch that I introduce with littles. And I show parents a lot of other tips and tricks depending on what is going on with their kiddo that they can introduce at home and do more frequently than when they're in the office. Lastly, I wanted to touch on tummy time. Tummy time, please remember, with the newborn, it is not always laying that newborn on their belly. Tummy time is also being held in the parent's arms on a chest, maybe across a lap. You're just putting some pressure on the tummy. When they're resting in a vertical position, that can also be really good to help with muscle and head control when they're little. As that child gets a little bit older and can tolerate laying on their tummy, tummy time builds head control with the neck and upper body strength and also coordination and movement. So they're starting to kind of push themselves up into this really nice position. It creates good tension down the front line and then strengthens the back muscles. So postural control and development is key in all infants. So when you have babies with digestive issues, they don't always love tummy time. So we want to be creative and find ways that they can introduce this pressure and this movement day to day. So with reflux, for example, some of the constipation and increased gas, we don't want to feed our child and then lay them on their tummy right away. We do want to keep them upright for about 30 minutes after that feed. And then you can introduce some of these tummy time positions. As babies continue to develop, their weight shifts, their body and head control shifts, and this all contributes to not only the body structure and formation, but also oral function. And it's really important to remember, I mentioned the mouth is the window to the belly, that as they are introducing this tummy time and postural control, they may have a difficult time swallowing and latching well if they really dislike tummy time. They have a tough time controlling that movement all the way through. So those are a couple of things that I like to cover with parents as they're in the office. Also check a previous video I did regarding proper diaper change positioning. It goes through some movements to also help move gas. So that's another video that I did previously. So check that out as well. If you have any questions, please feel free to contact us. I am here to help you and your family be their best, feel their best, and move better. Thank you.
Everybody's moving, everybody's moving, everybody's moving, 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 moving. Everybody's moving, everybody's moving, everybody's moving, 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 and